Hello my dear students, I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years and I love it. Today I'm starting my series on anterior triangle lectures. So here I'm going to talk about anterior triangle, muscular triangle and Ansa cervicalis. This has already been done. The link for this is available. You can go check this lecture out. Now today we're going to talk about carotid triangle and its contents. Okay, this will be followed by a lecture on digastric triangle. Before we begin, a request from me. Whenever you attend my classes, please sit with color pencils, drawing sheets or any digital drawing implement. But when I ask you to draw, I expect you to draw. This is not because I get some pleasure out of asking you to do drawings, but because when you draw, you use both sides of your brain, okay? So what happens is more amount of your brain is involved in the learning process, leading to better understanding and therefore better recall. So it benefits you when you do diagrams while studying, all right? So let's begin. Carotid triangle, my dear students. First, let's solve this MCQ to understand where are we in this topic. The superior belly of omohyoid forms the anterior border of which triangle? Muscular, digastric, carotid, supraclavicular. I think most of you know the answer, but there are still those who wonder, is this not? Okay. What are the other questions that get asked on carotid triangle? Let's take a look. Enumerate branches of external carotid artery, enumerate branches of vagus in the carotid triangle, and so on. Now, for understanding the carotid triangle and then attempting these questions, you have to have a solid knowledge base, okay? So today, let's acquire this knowledge. So, carotid triangle, we begin by bringing our attention to the anterior triangle. Where is the anterior triangle? Let's take a look. The anterior triangle is a triangular space which is bound anteriorly by the midline structures in the neck, posteriorly by the anterior border of sternocleidomastoid. I suggest you palpate all this on your own body as well. And superiorly bound by the lower border of mandible and a line drawn from the angle of mandible to the mastoid process. Use this image to understand this triangular space on either side of midline in the neck is called as the anterior triangle. So now this is a dissected specimen. You can see the anterior boundary formed by midline structures, posterior boundary formed by anterior border of sternocleidomastoid, and superior boundary formed by mandible and an imaginary line joining mandible to the mastoid process. Okay. So now draw this in your notebooks quickly. Anterior border, posterior border, and superior border. Okay. I hope you've got that. Let's take it forward by dividing this triangle into several 3.5 triangles with the help of one hyoid bone. Please draw the hyoid bone, students. Then draw the posterior belly and the anterior belly as shown. These are posterior and anterior belly of digastric muscle. And finally draw the superior belly of omohyoid. As you can see, these 4 structures are dividing your anterior triangle into 3.5 triangles. Okay. Today we are going to focus on the carotid triangle here, which is bound superiorly by posterior belly of digastric, in front and below by the superior belly of omohyoid, and posteriorly by the sternocleidomastoid. So this is the triangle we are looking at. Are you there in the class now, students? We saw the anterior triangle. We divided the anterior triangle into 3.5 triangles. Out of that, we are going to focus on the carotid triangle, okay, which is bound above by posterior belly of digastric, below by superior belly of omohyoid, and posteriorly by the sternocleidomastoid muscle. Okay, so let's take it from here. In the body, whenever you try to explain a triangular region, it's done under certain headings. These are the headings. Give the boundaries, give the roof, the floor, the contents, and applied anatomy. Common sense. Okay. So let's follow the same pattern and begin to understand the boundaries of this triangle in detail. Take a look at the dissected specimen. Posterior boundary we already know. Anterior border of sternocleidomastoid. In front and above, Yes, we said it was digastric. Yes, it is posterior belly of digastric. But posterior belly of digastric is always accompanied by its best friend. Who is its best friend, my students? It is the stylohyoid muscle. Take a look. It is the stylohyoid muscle who always travels with the posterior belly of digastric. Okay. So these together form the boundary in front and above. Who forms the boundary in front and below? Who forms this boundary? This is formed by the superior belly of omohyoid muscle. Okay. So now let's revise this and make these boundaries permanent in your brain. The posterior boundary is formed by the sternocleidomastoid anterior border. In front and above, it's formed by two muscles. You can see the arrows pointing to that. Can you check if you know what are the two muscles forming the boundaries in front and above? Yes, it's the posterior belly of digastric and its best friend, stylohyoid muscle. In front and below, it's the superior belly of omohyoid muscle. So you've got the boundaries of the triangular space, which is the carotid triangle. Let's now talk about the roof. We've got a triangle in the neck. We've got the boundaries. Now cover it up with a roof. What is the roof that you see when you're dissecting the cadaver? The first thing you see is skin. Then you see the superficial fascia. Then you see the deep fascia. So these three structures form the roof. Correct? But there is something more special in the superficial fascia that needs to be mentioned. Why are we mentioning it? Because when you are approaching this region for any surgery, these are the structures you are going to have to take care of. So what are the structures? Fat, of course. Muscle, which one do you find here in the neck? Of course, it's the platysma. Then cutaneous nerves for the wonderful sensations in your neck. What are the nerves there? Transverse cervical cutaneous nerve and one coming from parotid down, cervical branch of facial. Yes. Then you have blood vessels. Now here note, there are two veins you find in the midline, anterior jugular veins. Okay, these you have to especially take care of. So these are the structures you found forming the roof of carotid triangle. Skin, superficial fascia and its contents, and then the investing layer of deep cervical fascia. So now we've done with the boundaries, we're done with the roof. Shall we go to the floor? Come on. You're seeing a diagram here. Okay. See that from anterior to, it consists of two constrictors and two hyoid muscles. The floor is formed by two constrictors and two hyoids. Let's take a look. This one is a middle constrictor. This one is an inferior constrictor. Just for your information, constrictor are muscles of pharynx. Okay. As they constrict, your food material that you have eaten slowly gets pushed down into the abdomen. So two constrictors, middle constrictor, inferior constrictor. Inferior overlaps the middle, as you can see in the image. In front now you can see the hyoid bone. Passing up from hyoid bone is your hypoglossus. Passing from your thyroid cartilage to the hyoid bone is your thyrohyoid muscle. Present medial to it, can you see this green structure? This one is the thyrohyoid membrane. So quickly revise the floor now. Two constrictors, two hyoids, one membrane. Okay. Two constrictors, which are the two? Middle constrictor, inferior constrictor. Two hyoids, hypoglossus going to the tongue. Thyrohyoid going to the hyoid and a thyrohyoid membrane. All these together form the floor of your carotid triangle. So we're done with the boundaries, roof and floor. So our triangular box is complete. Open it and let's see what are the contents of the box. Okay, so let's go to the contents. See, most of the triangles will give you the same contents. There will be arteries, there will be veins, there will be nerves, there will be lymph nodes and there will be some other structures. So let's follow the same pattern. It also helps you to remember better. What is the artery you want to find in the carotid triangle? Obviously, you want to find the carotid artery, the common carotid artery, its branches enclosed within the carotid sheath, right? So let's study this beautiful concept of the lovely carotid artery. Now here below you are seeing the common carotid artery. Quickly recall, right common carotid, left common carotid. Left coming from arch of aorta, right coming from brachiocephalic trunk. Correct? So that's the common carotid artery you're seeing here. You can see it dividing into an external carotid artery and an internal carotid artery. Please keep on comparing what is coming on the screen along with the diagram that is also given for you as reference. The internal carotid artery actually just passes through your neck upwards to enter inside your skull, okay, supplying the interior of cranium. So does not give any branches here, okay. However, it remains enclosed within the carotid sheath. The external carotid artery, meanwhile, gives rise to 8 branches. Okay, what are these 8 branches? Come to the diagram, students, and start to see. The ascending pharyngeal is its first branch, superior thyroid, lingual, facial, occipital, posterior auricular, and the terminal branches, superficial temporal and the maxillary. So you are seeing 8 branches. But are all these 8 branches in your carotid triangle? No. Let's take a look. Now this here is your carotid triangle. Out of all these branches, only 5 are actually present in the carotid triangle. Okay, so let's study only those 5. These are my 5 arteries, ascending pharyngeal. Now here's your ascending pharyngeal. It's actually given off quite medially. So when you're dissecting, if you go looking for this artery, you may not find it easily. It ascends upwards along the wall of pharynx, supplying those muscles and structures around it. The second artery I want you to see is the superior thyroid here, which emerges and descends downwards towards, name thyroid, it will go towards thyroid gland. Goes towards thyroid gland, supplies thyroid gland, anastomoses with the superior thyroid of the opposite side, as well as inferior thyroid artery of the same side. It also gives a branch that pierces the thyrohyoid membrane. The next artery I want you to focus on is the lingual. Can you see that lingual is having a peculiar shape? This is called as loop of lingual. So when we were students, we used to say L for loop. That's how we remembered. It's up to you to find out your own methods. But L for lingual, L for loop, it forms a loop before it disappears deep to the hypoglossal muscle. Name is lingual. It's going to obviously supply your tongue. Very nice. Now quite towards the roof or towards the upper end of your triangle, you find 2 arteries given off. One going forward to the face, facial artery. One going backwards to the scalp, occipital artery. Okay. They're almost given off at the same point in the external carotid artery, just below the posterior belly of digastric. So the facial artery emerges and then soon disappears, passing into the digastric triangle and then finally supplying the face. So 5 arteries we saw in the carotid triangle which are branches of external carotid, were as follows. They are ascending pharyngeal, superior thyroid, going to the tongue lingual, going to the face facial, going to the occipital region, occipital arteries. So, having covered this, take a look at how hidden they are. Now, this is the artery inside the triangle, okay? They are not that easily visualized. You have to take the effort to dissect before you will be able to find each of these arteries without damaging them. We now come to their applied anatomy, okay? As you see here, in the proximal part of the internal carotid artery, as well as in the point where the common carotid divides into external and internal, it shows a slight dilatation. This dilatation is called as carotid sinus. The carotid sinus is actually a baroreceptor. It is able to feel the rise and fall in blood pressure. So accordingly, it responds by causing fall in blood pressure and slowing down your heart rate. Okay. Sometimes some people have a very sensitive carotid sinus. So any even slight change in blood pressure causes their blood pressures to fall, and with repeated episodes of syncope. Okay, that's called as carotid sinus syndrome. Also present in the posterior wall of the carotid sinus is something called as a carotid body. This is a neurovascular body which responds to your oxygen levels in the blood. it acts as a chemoreceptor. So supposing you are suffering from anoxia, low oxygen level, then it will cause a rise in the respiratory rate, okay? Or it will cause a rise in heart rate and blood pressure, trying to compensate for that low oxygen levels, okay? So carotid sinus, carotid body. Remember, both of these are receiving blood supply from the glossopharyngeal, from the vagus, and from the sympathetic trunk. Here you are seeing a person lying down and somebody is taking his pulse. So just imagine that a patient is draped for operation with a sheet covering the patient up till here. Okay, are you going to go groping for pulse? Never. So how will you feel the pulse? You can easily put your finger in front of the anterior border of sternocleidomastoid at the level of the superior border of thyroid cartilage and feel the pulsations. You can feel them on yourself right now. Okay, go feel. I can feel the beautiful pulsations of the carotid. Should I be careful about something? Of course I should be. I shouldn't go feeling both of them together because that's important blood supply to your brain. Immediately you will be putting the patient's brain into ischemic state. Okay. So reference to this, what is Chassenac's tubercle? Chassenac's tubercle is the tubercle of transverse process of C6 vertebra. You often palpate the carotid against that tubercle. That's the reference I was telling you about. Finally, an interesting question. Why do they label carotid as carotid? Why not something else? Why call it a carotid artery? So understand that the Greek, when they found out that when you press somebody's carotid, the person often goes into stupor or unconsciousness. So based on the word carotides, they called this the carotid artery. They found that if you compress both the arteries, the person becomes unconscious. That's also the reason why you should not compress both the arteries in the same patient in an effort to feel pulsations. Alright? Okay, so that completes our artery. In my carotid triangle, I found common carotid, internal carotid and external carotid arteries. I also found that external carotid artery gave rise to 5 arteries within the carotid triangle. The 5 arteries were ascending pharyngeal, superior thyroid, L for lingual, to my face, facial, to my occipit, occipital. Then we talked about some applied anatomy. Let's now come to the vein that lies right next to it, lateral to the artery. Again a question, why is the vein lateral? Why is the artery not lateral? Remember, artery gone, body gone, part gone. That is a very simple logic used by human body. So, arteries are always placed deeply so that they remain more protected. Okay. So, internal jugular vein will be lying lateral to the common carotid artery. Okay. Let's take a look. Here is the carotid sheath. You can see the internal carotid artery medially related to the common carotid at this stage. Posteromedial to them lies the vagus nerve. The internal jugular vein actually emerges from the jugular foramen at the base of your skull, begins to descend downwards, meets with the subclavian in the region just close to your clavicle, and together they form the right brachiocephalic and on the left side left brachiocephalic veins. These brachiocephalics finally unite to form your superior vena cava. My advice to all of you is, while we are talking about carotid triangle, you must talk about details within the triangle and always have a broad image of that vein. So vein coming from the brain through jugular foramen, descending down, meeting superior subclavian vein to form the brachiocephalic vein. Now, here is your triangle. In the triangle, the vein receives 5 veins. Okay. What are the 5 tributaries it receives? Common facial. If it's facial, then what should be received or posterior to it? Of course, the occipital vein. Also, it receives the lingual vein, the pharyngeal vein, and the superior thyroid veins. Okay. All this under the cover of the 2 sternocleidomastoid muscles. See, even then, very little of my internal jugular vein would be dissectable without reflecting a little bit of my sternocleidomastoid away from the field. Okay. So that completes the internal jugular vein. So we've done the arteries and we've done the veins. Let's now move on to nerves in the carotid triangle. These are enumerated nerves. That's the spinal accessory nerve, loop of hypoglossal, vagus, and cervical part of sympathetic trunk. Just remember, sympathetic trunk is quite deeply placed. Okay, unless you go deep doing deep dissection, you're not going to get cervical part of sympathetic trunk. Okay, right. So here's an image which is showing you the spinal accessory nerve here, the vagus nerve in the carotid sheath, and the hypoglossal nerve. Let's study them separately. So that's my spinal accessory nerve emerging out of the jugular foramen, passing through the upper part of carotid triangle, disappearing inside the sternocleidomastoid, which it pierces. It supplies the sternocleidomastoid, pierces it to enter into which triangle do you find behind sternocleidomastoid? Posterior triangle. So that's the journey of spinal accessory nerve in the carotid triangle. Let's now go to the vagus nerve, the vagus. The vagus nerve emerges out of the jugular foramen, begins to descend downwards through the carotid sheath, throughout to now exit into your thorax. It is a nerve that has huge amount of work in thorax, abdomen and so on. So just understand that it has a vertical course. While it's coursing through the carotid sheath, okay, it gives rise to 5 branches. Okay, I just want to show you this before we go to the next slide. That's the vagus, and these two are the internal and external laryngeal branches, which are branches of superior laryngeal branch of vagus. We'll talk about this. So now I can see the vagus traversing the entire neck region, where I say that it gives rise to 5 set of branches. The first is called as the pharyngeal branch. The pharyngeal branch will participate in the pharyngeal plexus. Next, it gives rise to something called as superior laryngeal branch of vagus. Superior laryngeal branch travels posteriorly, dividing into an internal laryngeal and an external laryngeal. Remember, internal laryngeal pierces the thyroid membrane to give supply to the mucous membrane of your larynx. The external laryngeal descends down, accompanying your favorite thyroid artery. Which is your favorite thyroid artery? At this moment, it better be superior thyroid artery, okay? Which is what I just taught you a minute back. So it accompanies the superior thyroid artery, finally supplying the cricothyroid muscle, okay? The vagus also gives rise to branches to carotid sinus and carotid body. We just studied that. It gives rise to superior and inferior cervical cardiac branches. Now these participate in cardiac plexus formation. And finally, it gives rise to the right recurrent laryngeal nerve. Does a question strike you, students? It should. It should. What's the question that strikes you? Yes, the question that should strike you is, why only right, madam? Why not left? Isn't it? Always when a question strikes you, it's good for you. It means that your brain is ticking and you're understanding what's going on. So now that's going to be homework for all of you. There are 2 questions I'm asking you. If vagus gives rise to a pharyngeal branch to form the pharyngeal plexus, what are the other nerves participating in pharyngeal plexus formation? I would love it if you wrote the answer in the comment section. Also, why right recurrent laryngeal? Why not the left recurrent laryngeal? Is there a left recurrent laryngeal at all? Find out and tell me the answer. Okay, right. So we are done with spinal accessory nerve. We have done studying vagus nerve. Let's talk about the hypoglossal nerve. The hypoglossal nerve emerges out of the hypoglossal canal, descends downwards, enters the carotid sheath, lying anterior to the carotid sheath, enters the carotid triangle, lying anterior to the carotid sheath. You can see the nerve now traversing forwards, passing over the loop of lingual. Remember, this relationship is almost constant. The loop of lingual is crossed by the hypoglossal nerve passing over it. Can you see it here? That's the loop of lingual and that's the hypoglossal nerve crossing over it. And when they reach the hyoglossus, The hypoglossal nerve passes in front of hyoglossus muscle. Lingual nerve artery passes behind it with the hyoglossus in between. I hope you got that. The hypoglossal nerve is accompanied by branches of C1. Okay, these branches of C1 travel with the hypoglossal nerve, hitchhike. That's the word. Okay, giving rise to two branches carrying C1 fibers. The branches it gives rise to are one, descendens hypoglossa, you can see it here. This meets with the descendens cervicalis to form your favorite loop of nerve, Ansa cervicalis. Leftover C1 fibers travel with hypoglossal, leaving it to supply the thyrohyoid and finally supplying the geniohyoid. Okay, so this is the story of the hypoglossal nerve. We are now done. We are finished with artery, vein and nerve. What are the contents left now? Let's take a look. A little bit of lymph node and others. So let's take a look. Here you are seeing a dissection that has been done from the side. Okay, you can see the internal jugular vein with a lot of lymph nodes on it. Okay, that's the carotid triangle. These lymph nodes are called as deep cervical group of lymph nodes. Okay, these are divided into an upper lateral group containing jugulo-digastric lymph nodes, a middle group, and a lower lateral group of lymph nodes containing jugulo-omohyoid lymph nodes. All this lies under the cover of your favorite muscle, which one? Sternocleidomastoid. Okay. Finally, the last thing is the content is the apex of parotid gland. Okay, this just makes its way. See, your parotid gland is somewhere here. It just comes down a little bit into your carotid triangle. Since we are enumerating contents, we must enumerate this as well. Okay. All right, students. Let's now understand why are we discussing carotid triangle so much in detail. Okay. That's because carotid triangle is a region that is involved in a number of very crucial surgeries. Which ones? Take a look. Carotid endarterectomy, carotid artery bypass, carotid angioplasty and stenting, jugular vein cannulation, access to vagus nerve for various procedures, and of course the block dissections of neck. So if you don't have a good knowledge of surgery, okay, you will not be able to safely perform these procedures and avoid complications such as bleeding, nerve damage or injury to surrounding structures. So that's why you have to know your carotid triangle well. So let's revise. What did we do? Today we brought ourselves into the anterior triangle. We divided the triangle into 3.5 triangles. We talked about where was the carotid triangle in the anterior triangle, and then we discussed carotid triangle as boundaries, roof, floor and contents. Contents we divided into arteries, common carotid, veins, internal jugular, nerves, spinal accessory, hypoglossal and the vagus, lymph nodes and others. Then we talked about the applied anatomy. So the diagrams for today's lecture are being uploaded as short videos on YouTube and elsewhere. The links are given. Please access those and practice your diagrams well. Let's now solve this MCQ. See if you are able to solve it. A triangle in which superior root of Ansa cervicalis separates from hypoglossal nerve is, yes, obviously it's the carotid triangle. A patient has come with metastasis of cancer in his neck with enlarged deep cervical lymph nodes. Remember deep cervical lymph nodes? I showed you an image recently. He is suffering from hoarseness of voice. Which of the following nerves is getting compressed by the lymph nodes? External branch of superior laryngeal, internal branch of superior laryngeal, recurrent laryngeal and pharyngeal branch of vagus. Just remember students, whenever they say hoarseness of voice, it's always recurrent laryngeal. Okay, hoarseness, recurrent laryngeal. Just make that combination, fix that combination in your brain. That completes my class on carotid triangle. Success is not something that is ready-made, students. It comes from your own actions. The walk the path, do your actions that will lead you to a successful, happy life. Okay, thank you, students. I had the pleasure of taking this class. I look forward to seeing you across the screen in some other lecture. Okay, thank you, students.